Hello, my name is George, and my project is on autism. Uh, there's a lot to talk about, so I'm just going to skip to the next slide. Autism. Autism is defined as a developmental disorder which affects cognitive learning and social behavioral interactions. It lies upon a spectrum, meaning that someone could be anywhere from very low functioning to very high functioning with autism, which means high functioning, you might not be able to tell at all or right away that they do have autism. They can get through tasks and learning and play much easier than someone who is low functioning, who has a much harder time with learning, eye contact, social interactions, and so on. My personal experiences, I am an ABA, behavioral applied behavioral analysis therapist. I've worked with kids and teens with autism for the last 3 years, so I was excited to be able to pick this topic. Um, most scientists agree that it is a genetic disorder. People have argued about vaccines, about um, all sorts of things, but the main consensus is that it is genetic. Genetics, uh, along with every other explanation, does fail to explain the sudden increase in diagnosis. I think that um, mental disorders were all just lumped into mental disorders, so we were able to really uh, diagnose autism and pay attention to that lately. But other things such as chemicals, lifestyle choices, things during pregnancy, all these things can affect the chance of autism. Um, most are diagnosed around the age of 3, which is good because the earliest response is the best for implementation and change. Um, diagnosis is pretty obvious in that you will see a regression. A child will start to talk and be social and cognitive and learn, and then all of a sudden regress. The words will drop off, the eye contact will drop off. All of these are huge signs of autism. Um, like stated earlier, children diagnosed um, when they're younger are easier to help. Adults, adult behavior is very difficult to change regardless of a diagnosis, meaning whether or not you have autism or anything, somebody in their 20s or 30s are going to have a hard time changing. And this is especially true for somebody with a developmental disorder. Difficulties in social behavior become lifestyle difficulties. Treatments, like I said before, I'm an applied behavioral analyst therapist, uh, which is extremely beneficial at an early age. It really helps the learning and social aspects. The limitations are more in the social aspects, in that we can teach them to learn. They learn to learn through ABA, but the social interactions are really the best way to learn them are on your own, or through your own mistakes. And unfortunately, parents tend to isolate or alienate their children because they're afraid of them. They're afraid for them, I should say. Medication can help, but that is not for me to say. That's for the parents, really. That's a very individual basis, because sometimes ADD, ADHD, and autism do overlap. Interestingly enough, Chapter 21 does describe autism and relates what I was saying before about behavioral problems that become lifestyle problems. Um, Rice also touches upon play therapy, which we have used in ABA. We use positive and negative reinforcement through play, which really does help teach. And Rice also suggests psychological intervention for mental disorders, which I also agree with because ABA is pretty limited in that it really benefits the younger more, and then they need uh, better equipped members for later on in life. But to summarize real quick, because we're running out of time, autism is on a spectrum. Regardless of cause or diagnosis, the earliest intervention is best. But to be honest, many people I've met are proud of being autistic or having an autistic family member, and wouldn't change anyway. So it's interesting. But thank you for your time.